folks, I'm Bob Schrupp, physical therapist.
Brad Heineck, physical therapist.
Because we are the most famous physical therapists on the internet.
In our opinion, of course, Bob.
We today have a back pain relief secret that we're going to share that you'll never forget.
And it's true. This
Yes.
is one of those things that stuck in my mind that I learned at a back conference a number of years ago. And I think you had...
Yeah, I think a lot of people have learned this one.
Right. As therapists will say, oh yeah, that is a good analogy.
And
so,
it'll give you a helpful hint of how to proceed in life so as to avoid back pain and also to stop your back pain from perpetuating and getting worse.
Perpetuating.
Yeah, I threw in some big words here,
Yeah,
Brad.
all right.
Word of the day.
But before we go any farther, Bob, let's take care of some
If you are
business.
new to our channel, please take a second to subscribe to us. We provide videos on how to stay healthy, fit, pain-free, and we upload every day. Also, Brad, do your job here. If you get a chance, you got to join us on Facebook. We got this sign just so you can see it's Bob and Brad. And Brad and I are going to give out positive vibes all this week to people who like us. But Brad, I got one more thing to say. Final thing. If there are links below, they may be for products. They may be affiliate links, which means we get a little fee for doing it.
Sure.
And we use that fee to help pay for videoing and our camera woman who's steeped in diamonds and gold and pearls. So we got to keep her. She's high maintenance.
Yeah. Hey, life goes on, Bob.
So thank you for buying products through us if you do.
We appreciate it. So Bob, back pain. Here we've got the spine, we've got our backs, but as therapists, we think of the spine with back pain. How many times have you had a patient come in with back pain and you say, so is there any particular reason your back pain started? And the majority of the time they say,
no,
it just kind of
came on
and very common.
Yeah.
So why is that happening? We're going to explain that to you. Not only are you going to explain it, but you're going to actually feel it happen in your body. A good analogy.
This is a participation video.
It is.
Yes.
It is. So here we go. We're going to start out with this first because everyone's just anxious to find out why.
Right.
First thing you got to do is put your finger up like this.
All right.
Okay, Bob?
Which finger, Brad?
Pointer finger,
Okay,
Bob.
pointer
finger. This
Okay.
is a family show.
All right.
Okay, so think about your finger. You got 3 joints here.
Right.
Okay.
Gotcha.
And the joints have muscles and soft tissue and whatnot. And we're going to put some stress on those, just like your back may have some stress. So take your finger.
So we're stressing the ligaments.
Right.
Yeah. The ligaments hold bone to bone.
Right. And the joints in there too. We're going to go to what we call end range. Pull your finger back. Now I want you to do this at home or wherever.
All of you out there now.
Right.
Come on,
if you got your
us.
cell phone and you're on the subway, do this. Put it down and pull your finger back. And I'm going to time you. Hold it. Keep holding it, Bob.
No, I'm going to show on here what's going on.
Well, they won't know. Go.
I mean, we can't be giving them silence for 60 seconds.
No, I can hold it though. I'm going to do it.
All right, keep going.
60 seconds.
So, what the analogy between the finger and the spine. Do you mind if I do this or not?
You do
There is a longitudinal ligament that actually runs all the way down on the back. And there's also ligaments that run between the bones, smaller ones.
Yep.
And if you put stress on the back in the same way you're putting stress on the finger, you can actually strain those ligaments and even get micro tears, and you can stretch them out, and you can be causing what we can basically cause your back pain.
Right. But let's talk about the disc. What can be happening?
Oh, sure. The other thing is by putting it in this position, you can actually be pushing the disc back. We got to show that with the cups, Brad.
Yeah. Okay.
I mean, there's no better way to show
We're still
that.
holding. We got 15 seconds.
While you're doing that, I'm going to get the cups.
Keep holding your finger back. If you look at your finger, it's going to be tight skin on this side, and you probably feel a little pain on your finger because we've got it pulled back and stretching the tissue and the joints. And there we go. That's 60 seconds. You can let go of your finger, and I bet you your finger does not feel good right now because you've been stretching it out for 60 seconds.
So this is how prepared we are. We're doing this on the fly.
Well, I had this figured out, but now we've got a better idea.
Well, let's show first, Brad, the position that your back is in when you're stretching it.
Just like your finger is stretched out, if you sit down with poor posture.
If you're sitting in a rounded out, slumped posture, which happens quite often, you're putting that same stress on your back that you're putting on your finger, in a sense.
Right. Precisely, Bob.
Yeah.
So where's the cups and
So
stuff?
people think that this is harmless to just sit there like this, but especially if you do it over a prolonged period of time, it really starts to stretch things out. And the other thing that can happen is it can start affecting the discs in your back. We don't have the pad thing to put on there. Do we have that around, Lonnie? Do you know where that is?
We used to always have it right up here.
Lonnie's not helping us now that we called her high maintenance.
Here we go.
There we go. There we go. We're ready. So we've got two vertebrae here. You can pretend that we pulled them out of the low back here. And between each vertebrae, you have a soft disc.
Right.
And on a healthy disc, bending forward like that in that seated position
Slouched.
is not a problem.
Right.
But over time, it starts to wear out. And what happens then, as it starts to wear out, the back of the disc can actually kind of give way, and you can end up with, am I doing it yet?
There you go.
Yeah.
That's a herniated disc or a bulging disc.
disc.
Can cause a lot of pain, and that can cause sciatica. So the whole idea with the finger is when you're slouched, it's same as with your finger becomes very painful in 60 seconds. Well, your back usually takes more than 60 seconds. It may take weeks, months, or even a few years of being slouched before that disc actually can bulge out.
Well, think about your day once. You get up, and if you have a decent drive into work, you might be driving for a half hour. So that's a half hour slouched. Then you go to a desk job, and you sit in your chair, and it's not a decent chair, and you sit slouched.
Or if they're doing a labor job, oftentimes they're bending over, working.
Prolonged bending over.
Right.
But this back pain really has become a issue of, it's become a sitting issue rather than a lifting issue more often than not.
Sure,
Because we are a sitting society now.
Right,
So,
oftentimes sitting. You think about cell phone, computer, soft furniture, laptops, car seat, all these things oftentimes are
promote
done.
that,
Poor posture.
promote this.
Right. So,
Yeah.
yeah, there you go.
Always. So we got to show at least one solution, right, Brad?
Right, which is seated posture.
Yep.
As a matter of fact, tomorrow, Tom is going to be driving a truck that has really poor seated posture. And it's so poor, he's going to have to use this particular.
Tom is a friend of yours, right?
Right, yep. That's not important who he is. He's driving a vehicle that has really a rounded out seat.
Sure, right.
I drove this truck for 7 miles and my back started to hurt.
Yeah.
Put this in there, it fills up that big hollow spot, and all of a sudden, voila, we have a comfortable.
That's the memory foam one that you like.
Right.
I don't like that one to me, and that's where this shows how personal this is.
Right.
When you're, especially in the car, this is way too much for me.
Yep.
I actually use this just real thin one. We don't even sell this. We bought a whole bunch of these to have ourselves.
Yeah, we give them off. We give them to patients.
And we give them to patients, and it's just enough for me. I put it right on my sacrum, and it locks me in place.
I do want to bring up a point, though. In this particular vehicle, I think you'd be happy with this.
Oh, right, 'cause
The
it
seat
sinks in
is
so much.
hollowed out. It's an older vehicle, and so the whole point is the seat and the body type changes what size. So here we got we got about 7 different varieties of lumbar supports.
Here's an actually air-filled one.
Yep, that's a
Brad
fun one.
likes this one, except it lost its air sometimes.
Well,
on there.
yes, I don't know if it's just a particular one I have, but you know, it's.
My wife likes it, but I don't like it at all either. I'm kind of starting to think I'm the picky one here because
Yeah.
I don't like it at all.
Yeah, everyone's an individual,
Yeah.
Bob. You have to learn to like yourself. That's a psychology thing.
All right,
We're going
thank
to
you.
start out on that later. But now this one is on oftentimes in an office chair, I think, would be.
Well, I
a
like
good
this
place.
one in an office chair, that big one.
There you go.
Yeah.
See, difference in personality.
Now, you
difference in
can
body
try a
shape.
rolled towel. And that's certainly what we often recommend that you start with because
Right here.
in that instance,
Look at
then you
this.
can kind of figure out what thickness you like.
Right.
And maybe you just end up keep using the rolled towel. I
Right.
mean, it's hard to simulate this one with a rolled towel because it's so big.
Right. Precisely, Bob. But this all comes back to this analogy. We need to get the pressure off of the back and get it relaxed and get it moving. Just like when you're done, if you move your finger,
It feels better.
It feels better. So with back, you're probably going to get up and walk. There's a lot of movement to the low back that you may not be aware of. So
Yeah, walking is often very good for the low back after if
Been
you've
sitting.
been sitting.
Right.
I'm actually going to be seeing a neighbor this week, and I know already because I know his work schedule and how he works.
Yep.
He flies a lot, and he goes overseas trips.
Sure.
And he drives a lot every day. And I know without seeing him, I know what he's going to have trouble with, and it's going to be that he sits too much.
Sure.
And so we're going to have to talk about maybe getting a sit-to-stand desk.
Oh,
or
I've oftentimes when people go on a flight or whatever, a patient, I say make sure you bring something on the plane.
we bring one.
for lumbar support.
I bring one every time. I
Sure.
I have 2 of these in my bag, and my wife and I slip them behind our back
Yep.
when we.
Yep.
So-
It's just the way it is. Either that or I ask for one of those blankets they give you and I roll it up. Aren't you going to cover up? No, I'm putting it for my back,
By the way, did you know on those blankets they don't clean them?
Well, it doesn't.
They don't. They just slide them back in the plastic bag.
Oh,
And it's
Bob.
like, no, this was on NBC, and the one girl goes, I snuggle up against that thing. It's like, that's not been cleaned. So, all right, everybody.
So
For that
anyways,
tidbit.
see, you'll never forget this video, but
That's right.
It's very accurate. It's going to give you a lot of help with your back and spine. So once again, we can help fix the back. But
We can fix just about anything
except for that
broken heart.
There you go.